All right, welcome to our Facebook Live with the University of Utah Health. Today's topic is adults and COVID-19. We have a couple of great experts with us today, which I'll introduce in just a couple of seconds here. Wanted to let you know that this is a joint Zoom/Facebook Live event, which is about COVID-19 and older adults and the emotional and mental impacts of COVID-19 as well. With us today is Dr. Mark Supiano. He's the chief of the Division of Geriatrics at U of U Health. And also Kathy Supiano, who is a PhD, also a licensed clinical social worker, and she is the director of Caring Connections for U of U College of Nursing, and a couple of really fantastic resources for people suffering from the emotional impacts of COVID-19. So this Zoom event, as I said, is also being broadcast on the U of U Health Facebook page. If you have a question in Facebook, we've got Alex there monitoring your questions, so just type them in the chat. And then, of course, participants on the Zoom, if you have questions, put them in the chat as well. So, you know, we've heard this over and over again: mask, physical distance, avoid large gatherings. And right now, that could be more challenging than ever, even for people that have been the most vigilant, because, you know, COVID fatigue. We've been doing this for a while, and we're coming up on the holidays where we want to connect with our families and friends, and we just really safely can't. As you all know, Utah has seen a record number of COVID-19 cases in the past several weeks, so it's important now more than ever and during the holidays that we do remain vigilant. I want to start with Dr. Mark Supiano, who is a gerontologist. What is your perspective on COVID-19, the elderly, and the holidays?
So Scott, I think you hit the nail on the head that everyone, ourselves, older adults, are experiencing fatigue from the seemingly relentless persistence of the COVID pandemic. As you also pointed out, the risk to everyone, and particularly to older adults right now today, is as high in Utah as it has ever been. So as vigilant we needed to be back in March and April, ramped that up now by 10-fold or 100-fold. So despite the ongoing duration of the pandemic and the fatigue that is setting in and the isolation that we will talk about, this is the time to remain vigilant. And those simple precautions of masking, physical distance, not going indoors where there are people outside of your home kind of bubble, and washing hands, all of the things you've been getting drummed into everyone over the last 9 months is all the more important now.
I want to talk about holiday travels. So, you know, this is something that I think a lot of families are considering, and a lot of us look at it as risk management, right? We know there's no such thing as zero risk, but we take a look at our lives, we take a look at those in our lives, and we make these decisions. Can we go and visit our families for the holidays based on those? What is your take on that?
So Scott, this is extremely challenging, and I think your point is well taken. It is risk management, and we'll never get that risk to zero. Right now, my personal opinion is that the risk is so exceedingly high that the short answer to the question is what I would tell my family, what I tell my patients now, is that you really should not be planning to travel over the Christmas holiday. This is painfully acute to Kathy and me. We are expecting our 5th granddaughter in Fort Worth, Texas, between Christmas and New Year's. And the reality is we know that we will not be able to travel to see her for some time. And even if we did travel to see the new baby, we wouldn't be able to hold her. So as difficult as this is, we can personally attest to, this is not the time to be letting down your guard, and certainly not the time to be traveling. I think the adage of Christmas in July is going to be a reality this year. And we should be thinking about planning to be outdoors in July, hopefully at a time when we can reunite with our family then. But this is not the time to be traveling. My personal opinion is that risk-benefit equation is so high on the risk side that it should not be done.
And I would imagine, especially if you are going to visit older people in your family. Like my mom is 90 years old, and I'm really struggling with that, right? So,
you know, to mitigate that risk would be, frankly, so complicated. You would need to quarantine for 2 weeks in advance of your trip. You would need a negative test before you go. You would need to adhere to all of the precautions during your trip. And that still doesn't bring the risk down to zero, as you said. So it gets very complex, and whether it's worth that kind of those added strategies to mitigate that risk, I would really have to seriously question.
Kathy Supiano, so would like to hit on now the mental health aspect of this. For a lot of elderly individuals, they look forward to these holidays for all the reasons that Mark said, right? So how can you kind of help your elderly family members feel not isolated?
Right. Well, it's a good point. And Scott, we are very aware of the danger of social isolation. Social isolation is a greater risk factor for physical and mental debilitation than smoking and many of the other known physical dangers. So we take it very seriously. But look at Zoom and look at the ways we can be creative. I think I'd like to start the question backwards, if that's all right with you. Older adults, if we're talking people in their 80s or your mom in her 90s or Mark's mom in her 90s, now people don't get to this age without having some resilience. This is not their first rodeo. Good luck finding an 80-year-old who hasn't had a heartbreak, who hasn't had a loss, who hasn't had to creatively reconfigure their social landscape at some point in their life. I really encourage the middle-aged adult children, the younger children, to flip this around and problem solve with their older adult engaged and say, what would work for you? What would feel good for you? Are we able to video open the gifts? Can I take you on the tour of my house? Can I mail the cookies in advance? December 15th is the drop dead day to get packages out, I think. So we need to think strategically. But again, Mark and I are children of veterans from World War II, the greatest generation. And this is really a miserable and challenging time. But my mother went for 2 years without seeing my dad during the war. And it was a letter and you dreaded the telegram. So this is something we can actually look to older adults for ideas and resilience. And instead of them saying, oh, mom's the problem, she's alone, saying, mom, join in, figure it out with us, and let's solve this. Now, we used to say, oh, the older adult, they're not going to manage the technology. And, it's not easy. It's not easy for me. But they're doing it. And it does take some creativity to guide people. And everyone needs like a 14-year-old kid in their orbit to help with this. But these are solvable problems. And thank goodness for technology. So I really encourage us to be creative. I encourage us to think that distance is not geography and hugs are not just tactile, that there are very creative ways we can do this. But this is a cross-generational challenge. And this should be like the games that families figure out during the holidays. So I view this as solvable, but people need to start thinking and practicing these things now.
We're with Dr. Mark Supiano, who's the chief of the Division of Geriatrics at U of U Health, and that's Kathy Supiano. She's a director of Caring Connections for U of U College of Nursing, talking about older adults and COVID-19 from not only a physical but a mental health standpoint. Kathy, I wanted to find out a little bit about the support groups that you're involved in, because I think these are both fabulous. Yeah, please share that.
Well, thanks, Scott. So we were really gifted and with money from the CARES funds directed to us through the state, through the Division of Mental Health and Substance Abuse Services. And they have equipped us to provide 2 kinds of programs ourselves and in coordination with the Spanish-speaking community as well. So that death is disproportionately represented in older adults. And so we were really well positioned to provide COVID grief support groups. These are all virtual on Zoom, encrypted Zoom, and they are for people who not only lost a person to COVID, but lost someone during the time of COVID, meaning they couldn't go to the nursing home during lockdown if mom died of congestive heart failure, not COVID, but something else, but they couldn't be present or they couldn't come to the hospital, families that couldn't have the funerals that they would have wanted, families that couldn't travel to be together. So we're seeing a real traumatic nature of these griefs in particular that's different from kind of our prior COVID grief. And then we're also offering COVID recovery groups. So this is care of what are called the long haulers. Utah's a very active group of long haulers. There's a Facebook page. There are people who have been very proactive as consumers, but many people are not aware of that, or they need additional support. Many people, and these are not just older adults, but very often older adults, have had very debilitating aftershocks of COVID. So fatigue, devastating fatigue, inability to return to work, some physical problems, blood clots, etc., but also really profound mental health changes that we know are actually part of the COVID disease process. There are many people who are profoundly resilient, engaged people before this, and they just have been slammed. So it's a support group, again, online, facilitated by trained clinicians who are really frontline mental health people in the COVID care community. I'm very proud of them. And again, all of these groups are free. So people can just call our office and get registered. And if we get an overflow group, we just are going to start another group. We can also offer this throughout the state. This is an advantage of distance technology, and it prevents people who are exhausted from having to get in their car and go somewhere. That would just tap them out. So we're ideally teed up to offer these groups, and people have been very appreciative of them.
Fabulous resource for somebody who not only may have dealt with COVID from a physical standpoint or dealing with the aftershocks of that, but from an emotional standpoint, not only people who have had COVID, but people who have lost people from COVID as well. The website you can go is healthcare.utah.edu/caring-connections, and we'll put that in the chat here. So that's healthcare.utah.edu/caring-connections, and you can find out about both of those support groups. Dr. Mark Supiano, the vaccination is the hot topic right now. We're all very excited to seeing life maybe go back to normal with the vaccination. Couple of questions on that. So we do have a question from online that vaccines were only tested up to 80-year-olds so far. Is there a concern about vaccinating adults older than that? Is that something that you're up on?
So it's a very insightful question, and points out really a systemic problem in many clinical trials or drug trials where not enough testing is done in the population that really is most at risk or is going to be receiving that therapy. There's some good news, and I don't know the data to be specific on 80-year-olds and greater. There's a paper in this week's New England Journal of Medicine that reported the antibody levels in the vaccine trial, and I don't remember which of the two trials it was offhand, but it did demonstrate that for people 70 and older who received the vaccine, that their antibody levels increased on the same trajectory as younger people. They achieved the same level of protective antibody, and it seemed to last as long as it did in the younger individuals. So to that extent, while it's never a good idea to extrapolate from 70-year-olds to 80 or 90-year-olds, I would be pretty comfortable at this point in time with the information that we have at hand and telling people who are most at risk, the 80 and 90-year-olds, and certainly as we're hearing, nursing home residents who are perhaps the most vulnerable and will be first in line for the vaccine, I would be personally very comfortable with a recommendation that those individuals should be vaccinated with the expectation that it will be effective.
Do you have more specific information on when an older adult will be able to get the vaccine, what that looks like? We had a press conference yesterday, I know, where we talked extensively about that.
Yeah, so as you know, the CDC, there's an advisory panel to the CDC that has made their recommendation. And I'm personally delighted as a geriatrician caring for many nursing home residents that the most vulnerable population, namely nursing home residents, as well as the providers and the workforce in the nursing home, not just the medical providers, but the food service providers and the custodial staff and everyone in that facility will be first in line in the first tier to receive the vaccine. So that's great news from that perspective. To answer the question about when the general population of older adults who are at risk, as we've been discussing, will be able to receive vaccine, I think that's still an open question. As you heard yesterday at the news conference, There will be recommendations that will be promulgated to each state, but each state at the present time is responsible for making their own dissemination plan. So when and how the general older adult population who is at risk, namely people 65 and older, will be able to start receiving vaccine is not yet clear. The projections I'm hearing is that it's likely to be this spring, so April perhaps, but that's still a work in progress, as you know.
But the good news is those healthcare providers, those nursing home providers are going to start to get that. So that kind of removes one of those vectors for when they go out in the community, then come back in. So that is good news. That'll start happening
Absolutely.
right away.
No, it is great news. And as you know, that first wave may be starting yet this month.
Gotcha. Dr. Supiano, so it's older adults that tend to be hospitalized and suffer more from COVID-19. What are we seeing currently? Is that still the case?
Yeah, so I did take the opportunity to pull yesterday's numbers from the Department of Health website, and kudos to the Department of Health for being very transparent with these data. It's a really rich resource of all this information. So the good news is that if you look at the number of cases in Utah, the overwhelming majority of cases are in people under age 65. So the older adults are getting the message, frankly, and just we talked earlier about the fatigue. The fact is most older adults know that they're at high risk and are doing the right thing. So that's good news. However, and following from that, most of the people in the hospital today are under the age of 65. The problem is that if you're over age 65, your risk of going into the hospital is all the higher, and your risk of death in turn. So just a couple of statistics that are current as of yesterday. So of the 917 deaths in Utah, 76% of those have occurred in people 65 and older. Okay, so just let that sink in for a minute. The population in Utah 65 and older is about 12%. So just let that sink in. The disproportionate impact on mortality that COVID has had in our state is overwhelming, and about 2/3 of those deaths have been in nursing home residents, back to the nursing home being the most vulnerable, the most at-risk population. So while the number of cases is fewer in people under age 65, their hospitalization rate is much higher. So overall, the good news is in Utah, if you test positive for COVID, your risk of going to the hospital is only 5%. So you're likely to have a fairly mild case, manage it at home, and recover. The long hauler discussion is a separate conversation, but your risk of going to the hospital is only 5%. However, if you're 65 to 84, your risk of going to the hospital is almost 19%. If you're 85 and older, your risk of going to the hospital is 27%. And then the death rates follow from that. So this is why we're focused so much and why we're still so adamant about maintaining vigilance among the older adult population, just because of these data and the exceedingly high risk that older people have.
I want to get to that topic about people letting down their guard here in just a couple of seconds. We're doing our Facebook Live today with Dr. Mark Supiano, who's the chief of the Division of Geriatrics at U of U Health, and Kathy Supiano, who is the director of the Caring Connections for the U of U College of Nursing. And we have some Facebook Live questions. If you have a Facebook Live question, put it in the chat. Alex, pop on in and let us know what that question is.
So one question on Facebook Live. My grandmother is 94 and very weakened. My mother fears the vaccine could somehow harm her. Is that a realistic concern?
So again, a very insightful question, and I am confident that we have very little, if any, data to refer to in a comparable population of patients. With that being said, and I will need to look in detail at these data, but what I've seen to date, the adverse event rate, including serious adverse events, from the two vaccines that are now under consideration by the FDA have been extraordinarily low and pretty mild. And to date, again, what's been published, at least for the 70 and older population, granted this is not the 96 and older population, that holds true, that there's not a higher rate of adverse events in the very old. So again, as Scott was saying earlier, it's kind of a risk-benefit ratio. Is your risk of getting COVID and having a mortality rate that's over 50%, great enough that you should accept a very minimal risk potentially of an adverse event from the COVID vaccine. Based on what we've seen so far, the adverse event rates are probably lower than they are from an influenza vaccination. But I would still recommend that 96-year-old woman you're speaking about, or the question is about, to get a flu vaccine. So the risk benefit, again, based on what we know at this point, with more data and to be following, I would err on the side of getting the vaccine.
Another question here from the news media. Could you address concerns that people seem to be letting down their guard against the virus because of the vaccine coming? What's your message to Utahns, especially those with older family members?
Mask up.
Don't let your guard down.
And distance. That attitude to me is like saying, we know that someday they're going to bring us seatbelts into our car. So in the meantime, we'll be reckless because someday there'll be a seatbelt. No, we can't do that. We just really do have to be attentive. I mean, this is, if we do say that the vaccine is the finish line, and there's a lot of work to be done after vaccination. I mean, vaccine is one big part of the solution. It's not the whole solution, but you know, it's like a marathon runner. Mark can speak to this. He's a distance runner. You've got to get over Heartbreak Hill. It's miserable, but you have to get over Heartbreak Hill if you want to finish the finish line and get there intact. So people really do have to say, I am willing to sacrifice Christmas, Hanukkah, New Year's celebration so that I can see the daffodils bloom in the spring. I mean, this is really the starkness of the choice. And, you know, and it is not my position as a grief therapist to guilt trip people here, but I just invite people to consider how they would feel if they were the vector that brought down the members of their own family. People really need to accept that with that level of responsibility. This is really where we set our personal freedom aside and say, the good of my family, the good of my neighborhood, the good of my church, the good of my state, the good of my nation. We just have to assume that we're carrying, or everyone we interact with is a carrier, and keep that distance. So sorry, now I'm off my soapbox, Scott.
Well, this is, as you've heard, this is not the time to let our guard down. And maybe to extend Kathy's analogy a bit further, it would be, you know, once you had airbags in your car as standard, you didn't stop wearing your seatbelt, right? You really need both. And right now, the mask is the effective vaccine that we have.
The mask is now, the physically distanced is
right
now.
Now, today,
we have
a vaccine. It's in the form of a mask and keeping distance and all the things that we know. It won't be until 60, 70, 80% of the population is vaccinated and protected that we will begin to think about letting that guard down.
Kathy, we talked a little bit earlier about getting creative around the holidays to help alleviate social isolation for elderly. What about if we get a sense that maybe some of our elderly relatives are feeling socially isolated? Are there some specific things we can do? Would you recommend one of the support groups? Is it just amping up the interaction with them? What would you recommend?
Oh, there are lots of great ideas. So one of the huge blessings in the state of Utah is we have one of the best distributions of area agencies on aging, older adult services. And I just met with the case managers earlier this week. They're deployed, they're out there. If you are far away from a family member and you know that they need a resource, get with your area agency on aging. They can deploy resources. People don't know Meals on Wheels are still working. They've had to shift most of their volunteers. We're older adult volunteers. The staff are now delivering meals. People are picking up meals. So services are out there. Connections are out there. Mobilize your faith community to do this. Again, this is not door to door. This is not visiting, but this is engagement. Increase the frequency of communication, increase the variety of communication. People can do really doofus things like watch a movie together. Mom's on her Netflix, you're on your Netflix, but you're watching the same movie, just like you would be together. People are cooking the same meal. people did some really fun things over Thanksgiving. I'm carving the turkey here. You show me your turkey, as well as, the drive-by of food deliveries and things like that. This is an invitation to be creative and also to be fun. Really, I mean, a lot of us have unspent vacation time. We have some time to plan some of these things. So it's just a question of thinking in different ways. And I would just really take you back to the war, to World War II, which that was an entirely national engagement. Neighborhoods were supporting each other because everybody had a son overseas, and people were doing things in different ways. And we can actually do that. People were going without food during the Depression and shared their garden produce. This is really, we talked about this before, Scott. This is an invitation to transform society in very fundamental ways and to create compassionate communities. And it's an invitation to all of us to connect with our better angels, if you were, and have this extended outreach. The other thing is older adults can connect with each other. A couple of the senior centers are, sharing lists and email lists and Zoom links and things like that. And so it's larger even than family members. It can be across family members, and we can check in with other people in their communities.
And of course, the challenge is these are all things that those of us that do have elderly parents have never really had to consider because we just had the way we've done things. So we really have to, and it can be hard. It can be a lot of mental work to think, all right, how can we make this work? So maybe do use one of those vacation days. Yeah. We're with Kathy Supiano. She's a PhD and a licensed clinical social worker and the director of Caring Connections for U of U College of Nursing. And also Dr. Mark Supiano, who is the chief of the Division of Geriatrics at U of U Health. Taking your questions on Facebook Live. Alex, you have another question for us.
Yeah, so if the elderly in assisted living get the vaccine, can they start coming out?
So good question that somewhat parallels what we were discussing before with respect to the vaccine. I think it will take some time before we can start to loosen some of these restrictions. But yes, if we'll need to see how these policies are rolled out at the assisted living level and also in nursing homes for that matter, where there have been fairly strict visitation policies. So the hope would be once there is a high enough proportion of residents in the assisted living and or the nursing home who have been vaccinated, and the staff, by the way, it's not the residents who've been the vectors, it's been the staff, the workforce who've been bringing COVID in and out of these facilities. Once a high enough proportion of that population is vaccinated, I suspect that there will be able to be some relaxation on those visitation policies. But however, back to the earlier question, just because you've been vaccinated doesn't mean you need to, or that you're able to let your guard down. You're likely still going to require to be masked. You want to maintain physical distance. There's still other things you can do to mitigate that risk, but hopefully there'll be an opportunity where visitors will be able to come in to see their family members and friends in those facilities.
And we're talking the vaccine has a efficacy of like 95%. So I mean, it's really good, but I think to reiterate, it's not perfect. So that reduces the risk quite a bit, but you still have to do all those other things. Yeah. Dr. Supiano, there was a new study out that delirium is often described as one of the first symptoms of COVID-19 in older people, which could be challenging because I think delirium is a symptom of a lot of particular illnesses for the elderly. Can you tell me more about that, or what some people are calling brain fog?
So this is a really critical point, Scott, and it's one of our teaching principles in geriatrics that the presentation of common illnesses in older people is often atypical or unusual. And to that point, in the setting of any serious illness, whether that's a heart attack or a stroke or any serious infection, certainly including COVID, that an acute change in someone's thinking and memory, or acute confusional state, a loss of memory very suddenly, that is known as delirium, can often be the signal that that older person is seriously critically ill. So in several studies now, COVID is presenting in older adults not with the usual constellation of fever and cough and just feeling crummy and muscle aches and all, but that acute change in their cognition. So we need to add that to the list of potential symptoms of COVID in an older adult, and be really on top of attending to that syndrome of delirium and managing that during their illness. It's also another reason why we need to be, why it's all the more important to help prevent delirium, because older adults with COVID in the hospital are at very high risk for developing delirium. We're fortunate at University of Utah Health that we've been able to transition our delirium prevention program, that's named the Hospital Elder Life Program, from an in-person volunteer being at the bedside with an older adult to prevent delirium, to offering that through technology, just like we're doing now through Zoom. And through many gracious donors, we have iPads now that we have available to assign to patients. They interact with one of our volunteers to work through some protocols to engage them, keep them oriented, do a lot of the social engagement that Kathy was just referring to, being creative, including music therapy. One of our volunteers is an accomplished cellist, and she plays the cello over Zoom for patients who are assigned in the program. So it's all the more important to prevent delirium. The reason for this, if you have delirium and COVID, your risk of death is double what it would be otherwise. So it's a real red flag. It's a very serious illness, and we need to be on top of that.
And normally when you go visit your elderly relatives, the holidays is a great time to kind of check in and see if they're starting to show those symptoms. We don't have that this year, so again, all the more reason that you should try to do some Zoom stuff and reach out on the phone and talk and that sort of thing. Keep in contact. We're going to wrap this.
Phone still works too.
Yeah.
Telephone still works.
We're going to wrap this up here in just a couple of seconds. We've got another question, Alex, and then we're going to just wrap this up. So thank you very much. Alex, what's our question?
Some older adults feel that they are missing out on their grandchildren's life. It's hard to convince them to stay home when they'd rather risk it, citing that they'd rather be with their family in person than have no risk. How do we convince our parents and grandparents to stay home?
Well,
I don't know. You want to take that, Kathy? As I said earlier, we're in the same boat.
This is our boat too, and another granddaughter on the way. This is just the difference of short-term sacrifice for long-term gain. This is really where you have to view life over the horizon instead of the life that's just in front of you. Mom and dad, that means you sit your kids down with the crayons and the markers and they send a picture in the mail every day, or you all watch pound puppies and what are, I forget all the names.
Or story time. We do story time.
We do story time with our oldest granddaughter every week, and she reads aloud to us as her younger sister interrupts and is disruptive, and it's great joy. So we just have to do this. We have to do this differently. We have to realize that transmission goes two ways. I mean, Mark and I have a daughter-in-law who's pregnant, and so again, we don't want to bring risk to her as well. So we just have to say we are in this for everyone. And, God bless us all. Spring will come. It will come. And you want to actually see your grandchildren next year too, and the year after that too, and the year after that too. So please, delayed gratification is life's hardest lesson, but it's a very important one.
Alex, we have another question. What is that on Facebook?
So you mentioned Christmas in July. Is that something you're asking people to do? Seems like it would be a better option to give them than having to cancel the holiday altogether.
Well, I won't claim to have created that, but if we can start a movement, why not?
Exactly, twice the gifts. Think of it. Plus, your children will be 6 months. Your grandchildren will be at a different developmental level. New toys.
So let's start a Facebook campaign. Christmas on July 25th.
Sounds good. Dr. Mark Supiano and also Kathy Supiano, thank you very much for joining us today. We do appreciate that. You can go to healthcare.utah.edu/coronavirus if you need any more coronavirus information. And of course, we have the Caring Connections link for the support groups for people who have experienced COVID-19 and people who have experienced loss because of COVID-19. That's healthcare.utah.edu/caring-connections. Final thoughts, and let's keep this to like 30 seconds. Dr. Mark Supiano, what's your final message on the mountain?
So one last point that we've not touched on, but just to make this important point, do not neglect your own health care during this time. If you're an older adult, there are ways to provide care remotely. We've had tremendous success doing virtual telehealth visits for our patient population. Don't neglect seeing your provider. Make sure that your own healthcare needs are being met during this time, because while COVID is obviously a risk, there's still the same risks that we always have of heart attack and stroke and those things. So don't neglect your general health needs.
All right, and Kathy.
We can take care of each other without touching each other.
All right, short and sweet. Thank you very much for joining us, and thank you for joining us with our Facebook Live for University of Utah Health. Have a great holidays.
My pleasure, Scott. Thank you. Stay safe, everyone.
Bye, Scott. Thank you.